Hello everyone, Dr. Shahid here, and in this video, we're going to talk about cleaning and shaping. As mentioned previously, there are three main steps of endodontic treatment, the first being access cavity preparation, followed by cleaning and shaping of the root canals, and finally, obturation of the root canal system. In this video, we're going to take a deeper look into the second step, cleaning and shaping. Alright, let's get into it. So what's cleaning and shaping all about? Well, the goal of cleaning and shaping is to, clean and shape the root canals of the tooth, typically to about 0 to 2 millimeters of the root apex. Now, as you can imagine, to do a good job of getting that close to the root apex, you need to know exactly how long the root is, and that's where working length determination comes into play. Working length is the length from a reference point in the mouth, typically a cusp tip, to the root apex. Working length can be determined a couple of different ways, but initially, the best way to measure it is on a well-taken periapical radiograph. This will give you the starting measurement to go off of so that you can begin the cleaning and shaping process. But once the majority of the pulp has been removed, you have to get a more accurate reading, and that's where the apex locator comes into play. The apex locator will allow you to pinpoint with great accuracy the exact location of the root opening. And typically, the measurement we get here will become our working length. Okay, now let's look at some of the tools we have in our arsenal to help us achieve the goals of cleaning and shaping. We're going to go over Gates-Glidden Burs, Barbed Broaches, of course our stainless steel hand files, and finally the almighty NiTi rotary instruments. Let's kick things off with the Gates-Glidden Bur. The purpose of the Gates-Glidden Bur is to pre-enlarge the coronal canal areas, which will give us that straight line access that we're always looking for. They have a long, thin drilling shaft with parallel walls and a short cutting head, which helps you with positioning the burr in the right area. Now, it's important to note that the burr is side cutting, which is important because the burr is aggressive. You wouldn't want it pulling you into the canal. Remember, we just want to enlarge the opening of the canal to make the rest of the steps more efficient and effective. And finally, it comes in different sizes to match all sorts of different canals, big or small. Next up, we have the barbed broach, whose purpose is to remove vital, entangled, or just plain difficult to remove substances from the pulp chamber or root canals. It's essentially a file with a lot of tiny sharp projections along the length of the file, and we call those projections barbs, hence the name barbed broach. The barbs attach to soft tissue very readily, and that's what gives this instrument its usefulness. Alright, stainless steel hand files. Okay guys, thus far the instruments I've gone over haven't actually been involved with cleaning and shaping the root canal. The Gates-Glidden helps us gain better access to the root canal openings, and the barbed broach removes stubborn tissue that's in our way. But the purpose of our hand files is to actually clean and shape the root canals. They have a 0.02 millimeter standard taper, and they're always color coded according to ISO color coding standards. As you can see, we have them lined up here from small to large: pink, gray, purple, white, yellow, red, blue, green, black, and then the colors repeat from white after that point. So the first three colors, pink, gray, and purple, only appear once. So there are a few different types of stainless steel hand files that I want to go over, the first of which being the reamer. Reamer files are what results when you take a blank file with a triangular cross-section and you twist it. Reamers typically have a rake angle of 20 degrees, but to be honest guys, you don't really have to remember these numbers. Just know that reamers have a rake angle such that it makes them good at enlarging the root canal when used in a reaming motion. So you may ask, okay, what is that? What's a reaming motion? That just means you turn the file into the canal, kind of like a screw with continuous clockwise rotation. You can't use a filing up and down motion with these files. That's just not what they were designed for. So because they enlarge the root canal when used in a reaming motion, you have to be careful with them. Our next stainless steel hand file is the curve file, or K file for short. Now, K files are what results when you take a blank file with a square cross-section and you twist it. Unlike the reamers, the K files are best used in a watch winding motion or filing up and down motion. Now, watch winding motion just means you're making small clockwise and counterclockwise turns to negotiate the file into the depths of the canal. Lastly, we have the Hedstrom file, or H file for short. These files are produced by taking blank files with a circular cross-section and milling it to produce elevated cutting edges. It essentially has a spiral groove running down the file, which gives it its characteristic aggressive cutting. Now, due to the nature of the spiral groove, as you can see in the illustration, you can imagine that the aggressive cutting of this file occurs during the pull stroke of the up and down filing motion. So essentially, it cuts during retraction of the file. Okay, now let's talk about file diameter. This is a pretty important topic since diameter is one of the factors that influences our decision for what file to use and when. So I'm going to define a few points that we can better use to understand how file diameters are assigned. The first is D0, which is denoting the diameter of the file at the tip of the file. So for a standard 10K file, which is the purple file, D0 would be 0.10 millimeters. That's actually why it's called a K10 file to begin with. The files are named based on their D0 measurement. Now we also have D16, which is the diameter of the file 16 millimeters from the tip. So you may wonder, why did they choose 16? Seems like a weird number. But it's actually because typically that's where the cutting flutes end on the file, 16 millimeters from the tip. And we also know that our file has a 2% taper, which means that starting from D0, every 1 millimeter up the file, the diameter increases by 0.02 millimeters. And that's why you see the 0.32 millimeter increase in diameter shown on the illustration, because 16 millimeters multiplied by 0.02 millimeters is 0.32 millimeters. Now, that's the increase in diameter from D0, but what's the actual diameter at D16? That's what we want to know. And we already know that the diameter at D0 is 0.10 millimeters. So all we got to do is add the 0.32 millimeters to the 0.10 millimeters, and we'll know exactly what the diameter is at D16. And the answer is 0.42 millimeters. So it seems complicated at first, but guys, as long as you remember that the files are named based on their measurement at D0, and that the taper of the file denotes the amount in millimeters that the diameter increases with every 1 millimeter increment up the file, you'll be able to field all calculation questions on your exam. Okay, so that's all I really wanted to cover with hand files, so now let's go to our fourth instrument. The almighty nickel titanium or NiTi rotary instruments. Now these instruments really have the same purpose as our stainless steel hand files. They clean and shape the root canals by enlarging the root canal diameter, but they do so in a controlled and conservative manner. They generally come in a 0.04 millimeter or 0.06 millimeter taper, or in other words, 4% or 6% taper. And the one in our illustration here is a 6% taper. And if you were paying attention to the video, essentially that means that the diameter of the file increases by 0.06 millimeters every 1 millimeter you get further from the tip. These files are used in an electric handpiece that rotates according to manufacturer's recommended RPM and torque values. And the great thing about them is the material itself. Nickel titanium has super elasticity and shape memory, which are the properties that make these rotary files extremely flexible. Alright, now that we've covered all of the instruments we have at our disposal for cleaning and shaping, let's actually look at the techniques we have to do so. The first technique we'll talk about is the step back technique, which uses increasingly diametered hand instruments to systematically shape and enlarge the root canal system. Now the key here is that we do this from the apical regions to the coronal regions. That's the important part. The enlargement occurs from the apex up, not the other way around. And the logic behind this is pretty simple. Let's say our working length is 20 millimeters as determined by our apex locator, and we take our 30 file to length, which cleans and shapes the apical region. Now, as you can imagine, we're going to need a bigger file to clean and shape the regions above. So one by one, we increase the size of our file while reducing the depth to which we take our files to by 1 millimeter increments. So we take the 35 file to 19 millimeters, we take the 40 file to 18 millimeters, and so on and so forth until we reach the coronal third. That's the step back technique. Our next technique is the crown down technique, which is really just opposite to the step back technique in that the apical region of the root canal is the last to be cleaned and shaped. So in other words, we start out with bigger files and finish off with the small files. Now this technique isn't often used with hand files and it's more typical for rotary instruments. Okay, so that's it for techniques, and the last thing I want to discuss is a couple of important considerations about cleaning and shaping that we haven't touched on yet. The first of these considerations is irrigation. This is undoubtedly one of the most important aspects of cleaning and shaping, because although the mechanical debridement of the canal system is crucial in removing infected soft and hard tissues, there are certainly nooks and crannies within the root canal system that can't be reached with our files. And so chemical debridement of the root canal system is also extremely important. And if you think about it, guys, you wouldn't necessarily clean a plate by just scraping off the food with a towel. You'd get some soap and water involved if you really want to clean it well. The same goes with endodontic therapy. The chemical irrigation not only flushes out debris created by our files, but it also actively dissolves and disinfects tissues. So it's extremely important to irrigate the canals between every file. Now, one of the most common irrigants we have at our disposal is sodium hypochlorite, aka bleach. Bleach is able to dissolve organic matter such as tissue, and this is also what gives bleach its antibacterial property. Now, it's important to note that sodium hypochlorite does not remove the smear layer. And that's because the smear layer is composed primarily of inorganic material. Finally, the typical concentrations used in dentistry for bleach range from 0.5% to 6%. Another common irrigant that we have at our disposal is ethylene diamine tetraacetic acid. Try saying that 10 times. We call it EDTA for short, and this irrigant works by chelating inorganic material, which conveniently is what our smear layer is composed of. EDTA also acts as a lubricant within the root canal system, which can help in the negotiation of canals. And finally, guys, the typical concentration used in dentistry for EDTA is about 17%. The next irrigant I want to talk about is chlorhexidine. Chlorhexidine is a synthetic cationic molecule that interacts with phospholipids and lipopolysaccharides on the cell membrane of bacteria, and it enters the cell by changing osmotic equilibrium. All of that fancy scientific stuff to say it's an antibacterial irrigant, and it's most effective at a concentration of 2%. Alright guys, the final point I want to make about irrigation concerns the combination of chlorhexidine and sodium hypochlorite. These two irrigants, if allowed to interact, form an insoluble orange-brown precipitate that we call perachloroaniline. This stuff is bad news, guys. It affects the seal of the root canal filling material, it's toxic in short-term exposure, and it's even been classified as a potential carcinogen in humans. So remember to avoid this duo during your endodontic procedures. Okay guys, the last thing I want to talk about is intracanal medication. We generally use intracanal medications for the purpose of disinfecting, but more importantly, preventing reinfection of the root canals between appointments. And our substance of choice here is calcium hydroxide. It's really the best medicament we have available because it has a very high pH, which gives rise to its antibacterial effects. More specifically, it's able to inactivate lipopolysaccharides and even dissolve tissues as well. Okay guys, that's it for this topic. Let's reinforce everything we just learned with a couple of representative practice problems. Each of the following is a characteristic of sodium hypochlorite irrigant except one, which is the exception. Pause the video if you need, and the answer is C, chelation of inorganic tissue. Remember guys, sodium hypochlorite only works on organic tissue. It can't remove inorganic portions of the smear layer. For our next question, we have a patient box. We have a 47-year-old female. Chief complaint, I'm here for my broken restoration. Background and our patient history indicates that she is type 2 diabetic, currently on metformin. And current findings indicate that we have a failed root canal treatment of the lower right first molar, and it also has a periapical radiolucency. Okay, so the question is, calcium hydroxide was applied between appointments as an intracanal medication. Which is the cause of its antimicrobial effect? Okay, pause the video. And the answer is B, high pH. This one is just something you have to remember. Calcium hydroxide has a very alkaline pH, which gives rise to its antimicrobial effects. Alright guys, that's it for this video. Thanks for watching. See you next time.